This is Kerri Wachter with Elsevier Global Medical News, reporting from the annual San Antonio Breast Cancer Symposium. Joining me is Dr. Hope Rugo, who is the Director of the Breast Oncology Clinical Trials Program at UCSF and on the Medical Advisory Board of the Oncology Report. Let's talk briefly about the TEAM study and what you think that adds to our knowledge of therapies for breast cancer.
The TEAM study was a big effort. It's actually enrolled over 5,800 women in a worldwide study. Each country had its own trial design, though. I mean, largely they were randomized to exemestane or tamoxifen, and then the trial was amended after the initial switching data came out to involve a switching arm, so then it was exemestane versus TAM, the switch to exemestane. But the stratification factors were different in each country, and that complicates the analysis a little bit. And I think also without the global, sort of unified oversight, maybe that led to some of the problems that they had with their data. And the biggest problem is that they had the crossover, but a lot of people weren't compliant with the therapy. So that ended up being a problem. They also had a lot of sub-studies, which I think they'll get a lot more information from. But so they pulled all the data for the initial, like, okay, is tamoxifen better than, is exemestane better than tamoxifen? And they wanted to be able to censor at the protocol-defined crossover from TAM to exemestane, so they had a cutoff of 2.75 years because at that point nobody had switched over. They switched a little later because the amendment to the study came later. So one of the problems that they had actually was that 30% of the people on tamoxifen and 20% on exemestane discontinued therapy before the switch, so within that 2.75 years. So that really creates a problem with their analysis. So if they just did 2.75 years and looked at everybody, although there certainly was, the appropriate trends towards improved outcome, they didn't see a difference in disease-free, relapse-free. They didn't see a difference in disease-free survival. Now, when they looked at relapse-free survival, which excludes deaths from other causes, and that's probably helpful in an older population, they did see a significant difference. And the time to distant metastases also was improved in looking at the whole population. So I think that that's very encouraging data, although again, 2.75 years is a very early time point in hormone receptor positive disease. They then did a second analysis where they actually just looked at people who took drug. So they excluded all those people who stopped the drug. They censored them at the time of the stopping drug, and then they excluded the people who were about 1% of people who never took a drug. And with that, then they did get a significant value, a hazard ratio of 0.83 and a p-value of 0.02 for disease-free survival. So what does that mean? It means that the TEAM trial was the last kid on the block. They were really, really hurt by the fact that the other trials reported first and patients were not compliant, and I think that probably was compounded by the multiple countries involved. And of course, it was not an intent-to-treat analysis to exclude the people who didn't take drug, and so that's a complicated issue as well. But they're kind of in a difficult situation. I think we all believe that the same results would be seen from TEAM that we saw from the other trials, that exemestane would be superior to tamoxifen. So I don't have any questions about that. And there was some additional data at this meeting that suggested that metabolism of tamoxifen may play a very significant role in the decreased efficacy of tamoxifen in these trials comparing tamoxifen to aromatase inhibitors. So I think that we still have a lot more to learn, but I certainly don't think that because they had problems with patient compliance that we should believe that exemestane is less of a good drug than the other aromatase inhibitors. But the data is compromised, certainly.
This is Kerri Wachter with Elsevier Global Medical News in San Antonio.